Welcome back. We're very happy to share the work of our next guest. Andrea Klimas is NAC's clinical director of the Patina Wellness Center. She holds a Bachelor of Arts in Psychology from Arizona State University and a Master of Science in Addiction Counseling from Grand Canyon University. She is a board-certified licensed independent substance abuse counselor. Tara Sundum, whom you met yesterday, is a board-certified neonatal nurse practitioner with more than 28 years experience in neonatal intensive care. She was a frontline worker in the growing opiate epidemic, caring for the most innocent of its victims, newborns suffering from neonatal abstinence syndrome. Her passion to transform the healthcare experience for them and their families led her to found Hushabye Nursery, an Arizona nonprofit dedicated to caring for opiate-exposed newborns in their first weeks of life. Thanks for joining us today. We'll start with Andrea.
Good morning, everybody. As introduced, my name is Andrea Klimas. I am Mexican and Oglala Lakota. I do identify as Indigenous, and I just like to acknowledge the Optum land that we're on and those ancestors that took care of it for us here. I am a clinical director here at Native American Connections, specifically our Patina Wellness Center. And so here I'm going to just introduce what we're doing to combine the cultural components in serving our pregnant and postpartum women here. So throughout this quick 15 minutes, ideally we just introduction to the treatment strategies that we're utilizing here for our pregnant women and our parenting families that are here in residential treatment with us that are struggling with substance use. How we've accommodated MAT services as part of their treatment program, if that is what the client chooses, and recognizing the benefits of the whole family treatment model, promoting intergenerational healing using both evidence-based and culturally appropriate practices here in treatment with us. So our mission since 1972, we are celebrating our 50 years, is improving the lives of individuals and families through Native American culturally appropriate behavioral health, affordable housing, and community development services. And we have grown in that way. Next slide, please. Thank you. So Patina Wellness Center, we primarily serve women, families, so couples with or without their dependent children. We do have 70 beds available. Our curriculum is a rotating 6-week curriculum, utilizing both evidence-based, so Living in Balance, Hazelden's, as well as culturally appropriate programs, Positive Indian Parenting, Healthy Relationships from the Cultural White Bison. Our typical length of stay depends on both clinical needs and funding. Health plans definitely have a huge factor on a client's length of stay. One of the challenges is the health plans will cover the parent. They do not cover the child in services. So I'll touch a little more on that in a minute. At our facility here at Patina Wellness Center, PWC, we do have a child care provider on staff. And so they're here to help our parents with healthy bonding, connecting their coping skills that they're learning in early recovery into their parenting skills, and take care of the children while the parents are coming into group. Next slide. So Native American Connections, we serve all peoples. Our priority population are Native Americans with substance use disorders, pregnant and parenting women, our IV drug users, opioid users, and families. We are medication assisted friendly, treatment friendly. We do not prescribe methadone, Suboxone, Subutex, but we do collaborate with those stakeholders that are providing those services. We do provide Vivitrol at our integrated clinic here. And then working with co-occurring disorders. We know in substance use, there's which came first, doesn't matter. They kind of come together, and learning how to manage both together. So intergenerational healing. There's a lot of intergenerational trauma, family cycles of trauma. So what we try to incorporate here is the healing component of that intergenerational. So since January, from January to June, we've served 9 pregnant women, collaborating with the client, their medical providers, working on their birthing plan. Some have their culturally traditional ways related to their birthing plans, and we try to incorporate that while here in an urban setting. We do serve people in Maricopa County, from Alaska, North Dakota, South Dakota, Nevada, that will come over. So we do meet the client where they're at, take their cultural preferences into their treatment here, including their birthing plans. We have served 9 couples, working with their clinicians on an individual basis, as well as couple sessions while here in treatment. Part of working with couples, not everybody here in treatment is coming in as a couple. So when we work with our couples, one of the first things that we're doing is identifying a safe place. So making that safe spot here that they can go to and know they can have their alone time, kind of process when things may be escalating. We've served 11 children here. Our child care provider works not just with the children, but they work with the parent or parents in a one-on-one session, as well as collaborating with the whole clinical team. So that focus is, education on developmental milestones with the child and parent, positive behavior skills, eating skills. So when we do have our families that come in and have had the experience, whether they were referred over by Hushabye or just reconnecting with their child from DCS care, and they're able to come in treatment together, we help to support that model of eat, sleep, and console with parent and child. And actually, it's kind of, regardless of the age, right? It's with substance use, we relate eat, sleep, and console to HALT. As an adult, are you hungry, angry, lonely, or tired? As a child, have they been fed? Have they been good napping, good sleeping? And how to console, supporting that healthy bonding. So we try and tie those concepts together. Next slide. So our child care provider, I'd say, at one time, we do try and keep a ratio of 1 provider to 5 children. At one time, we had 6. And so that afforded us an opportunity to bring in another child care provider. And at times, we do have a parent that may want to have a little separation anxiety when they come in, and understandable. So we work with them and accommodate them in the groups. They can take the child to group. And so we make those accommodations to help support their both mom and baby's adjustment, mom and child's adjustment to programming. So part of good quality care is helping to support that coordination of care with the different collaborators. So when we do have a pregnant mom that is looking to come into treatment, ideally, we want, and they're on an opiate, we would like to get a door-to-door admission when they're coming from detox. That's very important for mom and for baby. So we try to coordinate a door-to-door. We work with the MAP providers, and sometimes they're not established with a clinic and they want to. So no problem, we'll help them connect with a clinic, ITS, CMS, on establishing in those MAP services if that's what they choose to incorporate as part of their services here. Definitely, we're coordinating with the prenatal visits, the hospitals that the prenatal specialists that's going to be delivering, that they're working with. And we're located in mid-Phoenix, 7th Street in Virginia, and we've transported to all the way out to Mesa so that mom and dad can be with their regular OBGYN to deliver. So we do what we can to make it as less stressful as possible. So with COVID, and what's kind of helped to stand over is we've had a lot of the MAP providers are using the telehealth to do their weekly visits. If not, we'll take them to them. We want to make sure that they're staying consistent with their MAP program. And then working with DCS, probation, Hushabye, we do try to schedule those ART meetings so that everyone is on the same page, especially for our families when they have that DCS involvement. They have this unhealthy thinking of I need to keep everybody separate. And we try and work with them. Let's get your service plan, what your case plan, let's make these balanced. Let's help you so that they can see everybody is a support and remove that power perspective of authority there. Next slide, please. Okay. So again, meeting the client where they're at. So here's where we kind of have a breakdown of what our models are here, coming from that strengths perspective, incorporating the 12 steps along with the cultural medicine wheel and white bison trainings, learning that these are coping skills and relapse prevention. So these are all tools that they're going to take with them that they can use in everyday day-to-day life. So we incorporate smudging. We have talking circle. We do have the lodges, our sweat lodge ceremonies here. At one time, they were open to the public. We have not opened it up completely yet, but we have resumed it for our clients here. And accommodations are made for the parents that maybe want to attend and are not comfortable with the children going into the lodge. So we do make those accommodations there. Thank you. Focus is sobriety first is ideal. However, changes and complexities in substance use today require a reconsideration of how addiction can be treated. And this quote just really pretty powerful. Build a better world, said God, and I answered, how? The world is such a vast place and so complicated now, and I am small and useless. There's nothing I can do, but God in all his wisdom said, build a better you. And so we've seen parents increase their knowledge and their sobriety, and working with their 2-year-old, and their 2-year-old came in just running around and throwing toys all over the place. After they completed 60 days of treatment here with us, that 2-year-old would ask someone to come walk over to her, watch her do a puzzle, and she'd put the puzzle back and get another one and say thank you. Intergenerational healing. So our process begins with completing the intake and assessment with our outpatient department, utilizing the ASAM tool. Biopsychosocial assessment, determines level of care. When we do get our referrals for our pregnant women, we do prioritize those referrals because we know it's very, very small open window at times. And we want to do as much as we can to get mom and baby that head start in getting well, feeling better, cleaning up their system, both mentally, emotionally, and physically. So we do work collaboratively with Hushabye. They've call us. We do everything that we can to get them in as quickly as possible. And I've had some pretty successful outcomes. I think, Miss Tara, I think I'm done with mine. I'm sorry.
We're not seeing a Tara on the call just yet.
Okay, no worries. So we've had a few situations where Hushabye referred over a mom and dad, and they were ready. They came in, and mom was able to have her baby while in treatment. There was DCS involvement, and Hushabye followed up, worked with mom and dad. We did, this was in the middle of COVID, so we did allow dad, we gave him those passes to be at the hospital with them, because it was obviously a very high risk pregnancy. Mom had some other complications, and baby was born a month early. Mom got released and discharged from the hospital. Baby did not, due to other complications that needed to be hospitalized. The initial plan was to go to Hushabye, but we did get mom, baby, and dad back here together. DCS approved for baby to come here. And they not only completed our residential program, but they also completed our intensive outpatient program as well. We had another Hushabye referral where the mom had delivered, and she had started that referral process here with us and was able to utilize Hushabye. We were able to coordinate so that when the day baby got discharged from Hushabye into family placement with the paternal side, mom discharged from Hushabye and came over to us. She had a lot of resentment towards the paternal side of the family that had physical custody of the baby through DCS. But we were able to work with her through some family sessions over the phone to co-parent with the paternal side of the family. She completed program here at our Patina Wellness Center, and she actually transitioned into our outpatient and our NAC sober living. So she did almost 90 days here. Her health plan covered 90 days. Transitioned into our intensive outpatient for another 8 weeks while in our sober living, and continued to work on that co-parenting even from afar. And then she returned back to her community, Maricopa County, but just on the outskirts. So she wasn't quite local, but she returned to her community and checked in a couple of weeks ago that she was still doing well. She's still taking co-parenting to a different level, learning what that skills, communication style, putting herself first in her recovery to be able to tend to her child. So those are a couple of the ideal, wasn't easy, but a couple of the ideal situations where we were able to get them in right away, work with them whether they had child here or not. But we are, again, our biggest challenge is health plans don't pay for the child to be in treatment with the parent. We do have some grant funding that is allowing us to pay for the child to be here, which has increased to be able to serve those 11 children. So that is something that, you know, is needed as we have all these great programs coming in. Somebody that needs the 3.5 residential substance abuse treatment level of care, as a whole, as a community, that's an area where we can improve to help serve our families and keep them intact and together when they have these opportunities.
Thank you, Andrea. Wonderful presentation. I'm sorry that Tara got called away.
That's okay. It's the business we're in.
It is, absolutely.
Typically, we do take children ages up to school age. So typically 0 to 5. During COVID, we were actually able to take some older children. We had a 7-year-old that was from up north, Hopi Reservation, and because of their lack of Wi-Fi in that community, internet accessibility, the children were doing packets. So our childcare provider was able to work with her and improve her reading level and work with her on her packets. We took a 16-year-old who was here with mom, and we were able to get her engaged in our tree, which is geared for 16 to 24-year-olds. So we try and do what we can to really nurture that family unit and component there.
It sounds like you're doing wonderful work and really kind of creating that community for those people. Thank you so much. We are going to be able to break just a little bit early for lunch, but luckily lunch is next. So we're going to invite you to take some time to break and grab something to eat. If you want to see our 10-minute video that was created as part of the ADHS Stigma Reduction Campaign, Substance Use in Women, we'll be showing that again over lunch, this time at 12:30. This video does contain information and experiences that are sensitive in nature and may be emotionally triggering. So the experiences shared are for learning purposes only. You may choose to turn off your camera, step away, or grab a drink of water. But again, we encourage you to please take care of yourself, whatever that means for you. And then we'll begin the program again at 12:40. Thank you so much. See you back after lunch.
My name is Jessica. I'm 42 years old, and today I consider myself a free, loving mother. I have one son I just recently had 4 months ago, and I think that my son is like a super kid. And so, I mean, I guess all moms feel like that, but I really feel like my son is, just because like, I think he could say, I love you already. Like every time I walk in the room, he like lights up, and there's nothing like being loved by somebody and he sees no flaws. He knows no flaws, and I'm just, in his eyes, perfect. Although I'm far from that. My trauma started, honestly, when I was 7 years old. My dad died. He was murdered. With taking such a loss at such a young age, it traumatized not just me, but my entire family. With losing my dad, my mom ended up, which she's always been a great mom as she is today, but she ended up getting strung out on drugs and a heroin addict, and my family just fell apart.
I actually didn't have a mother or a father growing up. My mom's been on heroin since I was young, and I never got the chance to meet my father.
It all started with the trauma that I had when I was 3 or 4 years old. My uncle had molested me, and then when I got to be about 15, 14, he injected me with heroin. And he had me sell my body so that I would provide for his habit and my own.
I didn't know myself. I didn't like what I did know of myself, and I didn't want to find out anymore because I knew that whatever it was that I knew, I hated.
I do have abuse in my background. I could pedal around and just kind of like go through all of my life experiences, but just to sum it up, I've been through a lot of shit.
What started my addiction, I had like a lot of trauma, and so I guess I didn't want to think about the past. I didn't want to think about the present or the future, and so that's why I turned to drugs, and drugs is what did it, and it was a downfall from there. It was just not, I don't know how to, addiction's just not good. It's scary. It's really scary.
Honestly, the first time I did heroin, it was like, this is it. Like, I genuinely thought to myself, like, this is what I'm gonna do for the rest of my life. And I was A-okay with that.
Falling into opioid use was not something that I had planned. It's not something that I kind of even knew what I was doing. I just started taking pills one day and ended up getting something that wasn't as easy as I thought to stop doing.
People on drugs don't want to stay on drugs. Nobody's just happy and content with their life like that. But there's got to be a reason for you to get sober. And so when you find that reason, then you go and you seek the treatment.
At first, I didn't really I didn't care if I lived or not, honestly. I didn't feel like I had a purpose in life. I was just like, I'm just wasting oxygen, I guess. But then I got pregnant, and it was just a big blessing. turn my life around.
I don't think it's until I got pregnant that I genuinely wanted to get clean and thought it was possible.
I was pregnant since April of last year. I found out in July. I looked at it as a blessing. That was the reason, you know, to stay sober and to continue with my treatment. Everything happens for a reason, and I looked at that as something that was meant to happen to continue to push me to be the strong woman and person that I am.
Well, this last time I went to jail, I found out I was pregnant. And I couldn't believe it. I went back out on the streets and I was like trying to figure out what am I gonna do. And so I went to this program, CMS, and I found out that they had another program called Hushabye. They're like a lifesaver because they taught me everything. I mean, everything you can think of learning for a baby that was substance exposed.
I wanted to be able to speak with people that would understand where I was coming from. Because in that situation, you kind of feel like you're the bad guy. Like, I'm the one that messed up. You know, these people are just gonna look at me like I'm some drug addict. And like, I just wanted to walk into a facility or a place and people would treat me like they would treat anybody else, you know? And that's how I felt at Hushabye.
The one thing that women are scared of to like reach out is like being judged and like people looking at us wrong, you know, but Hushabye, there's no judgment at all. They're amazing women.
My name's Clarissa Collins, and I'm a peer support specialist with Hushabye Nursery. Our main goal is to help moms that are struggling with substance use disorder get into medication-assisted treatment while they're pregnant so that they can parent happy, healthy when baby gets home. My story with opiate use disorder began right after I had my daughter when I was 18, and I was just not ready. So now that I'm healthy and in a very stable place of recovery, I'm able to help other moms that are struggling walk the same path to get to the same point in life that I am. Sometimes all it takes is, you've got this. You're a good mom and you've got this. And I've seen those few words change a mom's entire perspective on things. That's the magic right there, is getting them to believe in themselves and them to understand that I can do this and I'm not a bad mom if I struggle.
When I was pregnant and I went into labor and I was in the hospital, the nurses there I felt like were super judgmental because I was honest that I was, you know, on methadone and that my baby was going to be born substance exposed and stuff. And I had a lot of education about it, but the nurses don't. You know, there's just pure judgment, like, oh, this, you know, lady's on drugs, her baby's, you know, like if I didn't care about my son, but they didn't realize I went through so much program to learn how to be a better mother before he was even here. And so I feel like that's one of the biggest experiences I had with being judged, is that they didn't know that I knew how to take care of my son or myself.
Just know me as someone who overcame everything, overcame things I wasn't even supposed to. And look at where the heck I am. I'm speaking to a world that I don't even know who's gonna be hearing me. You know, I don't even know, but I hope my kids see it one day.
That's all I care about. I don't care about what the world thinks about me. I just want them to see me and be proud.
I view my future now as being the best I can for my daughter, the best mom and the hard worker for hers, because I want her to look up to me and be like, I want to be like my mom one day. And I just want to give her everything I never had, you know. I just want to give her happiness and love.
My past doesn't define me at all. I learned from it, and that's helped build my character, but it doesn't define who I am. You know, I'm not that hooker. I'm not that stripper. I'm not that drug dealer. I'm a good person. I love helping people. That's my purpose in life. I used to say my syringe was half full. Now I say my cup is half full because I drink coffee now. See me differently. See me for who I am and not who I was. Because who I am now is someone who I'm really proud of.
You know, it might sound crazy or funny or whatever, but I really feel like my purpose today is to help somebody else to know that, you know, there is a light at the end of the tunnel. And for so many years, it looked like there wasn't. And there is, and there will be somebody right there to reach out and give you their hand. And I'm one of those people, you know? And so I'm gonna help whoever I can and save whoever I can and educate whoever I can.